Good day, I'm Hanz Nicole from BSN-4D, and today I will be performing my return demonstration of inserting and administering a tube feeding and removal of the nasogastric tube. Safety precautions: perform hand hygiene, then check the room for other or additional precautions. And introduce yourself to the patient and confirm the client's identity using two client identifiers. Good day, ma'am. I am Hanz Nicole and I will be your student nurse for this afternoon. May I know your name, ma'am? And your date of birth? Okay. Then explain to the client what you are going to do. Offer analgesia and bathroom use if needed. And listen and attend to the client's cues. So for this afternoon, I'm going to pour this feeding solution into your tube, and this will go directly into your stomach. And this procedure may cause some discomfort, such as any pain, or it may cause any cramps in your stomach. So just let me know by raising your hand, and then I will slow down the solution. Then ensure the client's privacy and dignity by closing the door to the room and closing the curtain around the client's bed. Then assess their safety, ABC, oxygen, and suction if there are any, and apply the principles of safety and sterile technique. And then check the client's vital signs such as their temperature, pulse, BP, heart rate, respirations, and oxygen saturation. Then complete any other focus assessments. Perform hand hygiene, gather supplies, and check the doctor's orders. Gather the correct amount of feeding solution, 20 to 50 ml syringe with an adapter, emesis basin, bulb syringe, calibrated plastic feeding bag, and a drip chamber which can be attached to the tubing or pre-filled bottle with a drip chamber, tubing, and a flow regulator clamp, measuring container from which to power the feeding, 60 ml water at room temperature unless otherwise specified, and feeding pump if needed. Prepare the client and the feeding. Explain the feeding to the client. Provide privacy. Position the client in Fowler's position, in bed, or sitting position in a chair. But for a small child or infant, position them in your lap and provide pacifier during feeding. Assess tube placement. Attach the syringe to the open end of the tube. Aspirate alimentary secretions and check the pH. Assess for residual feeding contents. Aspirate all the stomach contents and measure the amount prior to administering the feeding. If 50 ml or more anti-acid formula is withdrawn in adults or 10 ml or more in infants, check with the nurse in charge before proceeding. Reinstill the gastric contents into the stomach if this is the agency or the physician's practice. Remove the syringe bulb or plunger and pour the gastric contents via the syringe into the nasogastric tube. Administer the feeding. Before administering, check the expiration date of the feeding and warm the feeding to room temperature to prevent cramps. In using a bulb syringe, remove the bulb from the syringe and connect the syringe to a pinch or lump nasogastric tube to prevent air from going in the tube. Then add the feeding to the syringe barrel.
Permit the feeding to flow in slowly at the prescribed rate. Raise or lower the syringe to adjust the flow as needed. Pinch or clamp the tubing to stop the flow for a minute if the client experiences discomfort. Rinse the feeding tube immediately before all the formula has run through the tubing. Instill 60 ml of water into the feeding tube and be sure to add the water before the feeding solution has drained from the neck of a bulb syringe or from the tubing of an administration set. Clamp and cover the feeding tube. Clamp the feeding tube before all of the water is instilled. And cover the end of the feeding tube with a gauze held by an elastic band. Ensure client comfort and safety by pinning the tubing into the client's gown and ask the client to remain sitting upright in fowler's position or in slightly elevated right lateral position for at least 30 minutes after the feeding. Dispose of equipment appropriately. If the equipment is to be reused, wash with soap and water so that it is ready for reuse. Change the equipment every 24 hours or according to the agency's policy. Document all relevant information, including the feeding, amount, what kind of solution is taken, duration of the feeding, and assessment of the client. Record the volume of the feeding and water administered on the client's intake and output record. Monitor the client for possible problems. Carefully assess clients receiving tube feeding for problems. And to prevent dehydration, give the client supplemental water in addition to the prescribed tube feeding as ordered by the physician.
Prior to removing the tube, we will perform the safety precautions, perform hand hygiene, and check the room for additional precautions. Introduce yourself to the client and confirm the client's identity using 2 client identifiers. Good day, ma'am. I'm Hanz Nicole and I will be your student nurse for this morning. May I know your name, ma'am? And your date of birth? Then explain to the client what you're going to do. Listen and attend to the client's cues. And for this day po, we are going to finally remove your tube because your doctor have already ordered that it is safe for you to eat by your mouth. And during the procedure later, if you feel any discomfort or pain, you may raise your hand so I can pause for a while. Then ensure the client's privacy and dignity by closing the door to the room and closing the curtains around the client's bed. Assess the ABCs, suction, oxygen, and safety of the client. Apply principles of sterility and safety. Check their vital signs and complete any other focus assessments. And now to begin the procedure, we can perform hand hygiene by donning clean gloves, and gather the supplies and check the doctor's orders. For the other supplies, we need a waterproof pad, tissues, 20 ml syringe, and here are the non-sterile gloves, and this is our yellow garbage bag. And now we have verified our client's orders to remove the tube. And I have already verified our client's identity and explained to her what we will be doing. And now the client is also in Fowler's position, so now
Disconnect the tube from the fitting if present. Remove the tape or securement device from the client's nose. Unclip the NG tube from the client's gown. Clear the NG tube by inserting 10 to 20 ml of air into the tube. And instruct the client to take a deep breath and hold the NG tube. Kink the NG tube near the client's nares and gently pull out the tube in a swift, steady motion when the client takes a deep breath and hold it, wrapping it in your hand as it is being pulled out. Dispose of the tube in the garbage bag. Offer tissues or clean the nares for the client and offer mouth care as required. Remove gloves and place the client in a comfortable position, assess their level of comfort, and perform hand hygiene. Document the procedure according to agency policy. This ends my demonstration. Thank you for watching.